This new system, this new social democratic system of full employment and social security for all was predicated around the idea of a nuclear family with a male breadwinner wage. And a great example of that was the retreat that was evident in the granting of the Universal Family Allowance in 1945. So you'll remember that Eleanor Rathbone, part of the new feminist push in the 1920s and 1930s, had argued that women should be paid for their domestic labour, and that there should be a direct payment by the state to recognise women's labour in the home. When the family allowance came in 1945, the radical component of it was that it was given to all members of society, irregardless of the degree of wealth or poverty that they lived in. The less than radical component of it was that was justified as a payment to the child, not to the mother. Okay? So it was a payment that was given to women on behalf of their children. And motherhood became increasingly, just as it had after the First World War, so too after the Second World War, there's an enormous push to try and get women back into the home and to back into a conception of motherhood as a key social responsibility. In some ways, this was a product of the fact that the birth rates had been declining since the beginning of the 20th century, and Britain was experiencing an increasingly aging population. So between 1901 and 1951, the percentage of the population under 1 year old fell from 15% to 10%. Those over 60 rose from 5 to 10%. You want those figures again? From 1901 to 1950, 51, 15 to 10% of the population were under 1, i.e. 15% in 1901, 10% in 1951, and 5% over 60 in 1901, 10% by 1951. And as we saw very briefly in that discussion of evacuation last time, the new psychological services had increasingly emphasised the importance of the attachment between mothers and their children. And the idea that absent working mothers would produce antisocial children, juvenile delinquents, became very common in the delivery of social services, and was authorised by the studies of John Bowlby in his book, The Maternal Care and Health, published in 1951. Okay, there's a lot there, but I've got a lot more to get in, and then I'll stop at the end and you can ask me about all of this stuff and anything that is not clear. Let's talk about education for a bit. 1944 sees the passing of the Education Act that provides compulsory school to everyone up to the age of 15. It was passed by a Conservative minister and yet seemed to provide an unparalleled level of education to British children. Tried to provide a more a system that promised to provide equality of educational opportunity for all children. And it did that in very complicated ways. First of all, it didn't abolish private schools. The abolition of private education wasn't even really on the agenda in 1944. What it did was abolish fee-paying grammar schools and made them and maintained them by a direct grant from government. Some of those grammar schools broke off and became independent private schools. There is a massive expansion of school construction, many in spectacular sort of modernist concrete designs like the one that you can see on this slide. 536 new secondary schools were built between 1945 and 1956. But over 5,000 schools were left over from the pre-war period, and most of those had been constructed after the introduction of the Education Acts of 1870 and 1880. So much of this new educational system would continue to be housed in this old Victorian infrastructure. A sense of the way in which education would provide a new model for the construction of a complete and holistic social community was also evident in the provision of universal school meals. School meals provided to everybody. You'll remember that school meals had been introduced in 1906 as a way of trying to improve the health of the poor. Now they were going to be provided to all children, and yet there was a distinction between those who were going to get it free and those who would have to pay for it, and this was done by a means test. So you remember the hated means test of the restructuring of unemployment benefit in 1931. In many ways, this was just transplanted on to the education, to the school meal program, so that if you came in under a certain income level, household income level, you got the free meal, and that lasted down until 1968, when someone called Margaret Thatcher actually abolished it. By 1956, only 48% of the school population actually ate school meals. And the idea of the canteen or the cafeteria as this great mixing ground, this great place where people of all classes would mix together, became increasingly chimerical. I love this image of this school. This is Edge Hill Secondary Modern School in Liverpool, built in, I think, 1956. Rather than getting rid of class differences, then, the education reforms of 1944 and the following decades actually reinscribed them in quite important and profound ways. One reason for that was that children had to take an exam at the age of 11 called the 11 Plus. And this exam would stream them into different types of schools. Now, the educational theorist, Cyril Norwood, basically had come up with this idea that there were three types of minds. There was the abstract mind, the concrete mind, and the mechanical mind. And effectively, these three types of minds mapped quite easily onto the British class system. So abstract intellectual work, like You're All Capable, was the elite upper middle classes. The concrete mind was that of the unthinking working class, fit for manual labour, and the mechanical mind was of the new breed of technical expert that was going to populate the offices of state. Not only did this map onto the different class system, it also mapped onto the three different types of schools that were available after 1944. The grammar school, the secondary modern school, and the technical school. So 15% of school children went to the grammar school to engage and develop their abstract minds. 78% went to secondary modern schools to be prepared for a life of manual labour, and then 7% of school children went to the so-called technical schools. The other part of the failure of educational reform in the 1940s was the failure to democratise the university. The key difference between Britain and America here is that Britain didn't have any GI Bill. In fact, university education remained the preserve of a very narrow social elite. 2% of the population went to university in 1939, and by 1963 that had expanded to just 4%. Now, that tiny expansion had been made possible by the provision of scholarships that the Education Act had brought in, and there were a whole new series of campuses of universities like Nottingham, built in 1948, University of Southampton in 1952, University of Hull in 1944, Exeter in 1955, Leicester in 1957, etc., etc., etc. So there were new campuses, and there were new people going to university, but it remained a remarkably small percentage of the population. Anybody else wanting a type of higher or further education basically went to adult education classes. And in 1945, the Workers' Educational Association, the WEA, was holding classes for about 20,000 people, and that grew over the next decade quite considerably. So, that's education. Let's look at health. Before the war, Britain had basically had a tripartite system of healthcare, if indeed you could call it a system at all. There was healthcare provided by charity, there was private healthcare that the salaried middle classes could use, or there was healthcare through insurance. And there were basically two ways of doing that. One was through social insurance, which of course was limited to a certain number of workers, as you remember, and through organisations called friendly societies. And all hospitals were basically organised on a sort of local level, including those, of course, provided by through the Poor Law. As early as 1930, the British Medical Association, not an organisation renowned for its radicalism, had begun to conceive of a new type of nationally organised healthcare system. And this was a plan that they pushed again in 1938, and you'll remember the Organisation for Political and Economic Planning had also come up with a plan for a national health service in 1937. So in 1946, Britain gets its fabled NHS, the National Health Service. And the National Health Service is committed to providing free healthcare to everybody. Completely free healthcare to everybody, and healthcare included dental care, optometry, and mental health, as well as regular medical care. Over 1,000 local voluntary hospitals were brought into this new national system, and all the doctors and auxiliary staff working within it were put onto a unified single salary scale. Moreover, there was a creation of a new type of system that worked in a type of a triage system, where you had a local general practitioner, a GP, that you would be your first port of call. He, because it was almost invariably he, although there were women doctors in growing numbers in the 1950s and the 1960s, could refer you to a local hospital for extended treatment, and there was the provision of so-called community health services outside of the hospital system, such as maternity and child welfare clinics, the provision of health visitors and midwives that would visit you in people's home, and health education programs that were carried out in schools, where, for instance, things like vaccination often took place. So this is a hugely ambitious, very radical, sweeping measure that makes Obamacare look pretty pathetic. But it also had real limitations and constraints. Even though there were an enormous number of new hospitals constructed in the 1950s especially, most hospitals were taken over from the old voluntary sector, the old Victorian thing. Some often many old workhouses became hospitals. I just heard a radio program yesterday about a hospital that just closed down that had been an old Victorian prison. And 21% of those hospitals had been built before 1861. So there's another good example of the sort of Victorian infrastructure of the new social democratic system. And the amount of money, capital investment in new hospitals was tiny compared to that on housing and education. £500 million were invested in housing and education. Up to 1954, just 10 million had been invested in the health sector. Almost there. Housing is the last area, and then I'm going to give you a break. So you'll remember that the war and the experience of the Blitz had basically meant that Britain had lost something like 1 million houses during the war. And you'll also remember that during that process, new plans for the reconstruction of British cities had gathered apace. In many ways, the most influential of these planners was Patrick Abercrombie, who you've met before as part of the group that set up the Council for the Protection of Rural England, and was a professor of town planning at the University of Liverpool and then at University of College London. Patrick Abercrombie is hired by the government to create new plans for a number of cities, including Plymouth, which had been very badly bombed because it was where the Navy was based in 1943, and most famously his plan for the County of London later that year. What you see here is his plan for Plymouth. One of the interesting things about the town planning that went on for reconstruction is that many people have the preconception that they were simply imposed by these new town planning experts. In fact, there is a really interesting process in which town planners like Abercrombie undertook a whole series of social surveys and forms of public consultation to try and get people's input into how they wanted their cities to be rebuilt. So there was an attempt to try and democratise the programme of social reconstruction in cities. The key point that I want you to get here is that, for Abercrombie at least, reconstruction had to be about creating a new type of social community, just as in education and in healthcare. And for him, that meant designing cities around discrete villages that would be socially mixed. Okay? There had been a widespread perception that the development that had occurred in the 1920s and the 1930s had led to colonies, what Aneurin Bevan, the housing minister, called colonies of low-income people and rich people, a basic social segregation in towns and cities. And the idea of town planning was to try and hybridize cities around what were effectively the idea of an ideal village type. So here you see his plan for London, which all of these little circles represent the villages of London, what he wanted to think about as the villages of London, where they would have their own organic and socially hybrid communities, like he thought still existed in the countryside. Now, there were several limitations to the reconstruction of British cities. There was a limitation on the number of houses that could actually be built, and this became a huge political battle between the Labour Party and the Conservative Party. The Labour Party built around 200,000 houses a year during its administration. The Tories came in claiming that they could build 300,000 a year, and that was something that they achieved during the early 1950s. But the emphasis on the numbers of housing meant that the types of public housing that was created, because all of this state-sponsored construction of housing was public housing, which is what we think of as projects. Many of them lacked the key resources that people thought were critical to building new types of communities. So out of 100 estates in 1952, for instance, only 1 of 46 nursery schools had been constructed, 6 out of 24 infant welfare clinics, 2 out of 22 playgrounds, 4 out of 50 community centres, 11 out of 46 libraries. Remember that the whole thing about planning, the absence of planning in the 1920s and 30s, is that you could have these vast estates without any transportation networks and no community services. So this was a determined attempt to try and avoid those failures, and they were severely circumscribed in terms of the actual community resources that went on the ground. The attempt to democratise the housing project was also evident in the creation of community associations in 1945, which were going to self-govern these new housing estates. And it was thought that this too would be a place where there would be a mixing of social groups, and this would help create the very model community that the government wished to build. In fact, we have some evidence that very quickly these community associations became dominated by the middle classes, not the working classes, and that many of the residents of these estates felt excluded or antagonised by the work of their community association. Let me show you a quick clip of this stuff on town planning, just so you can stop waiting for a bit if this works. Why is it not working? Nope. Sorry. The technology is failing me. See if this will work. No? Okay. So rather than watch a little movie, I'm going to show you another movie in a moment. Does anyone have any questions over that vast amount of material that I've just splurged upon you? Is it clear that the key things that I'm trying to say here, which is that in all of these areas that I've been talking about, you can see an attempt to create a new universal conception of society as one big community, where everybody gets universal benefits, where everybody gets an education, where everybody gets healthcare, where everybody gets employment. But within that conception of a universal society, there continue to be marked differences of provision or of experience. That's really the key thing that you have to get, as well as the fact that many of these new developments were constrained by the financial conditions in which they were created, and therefore they were housed in this Victorian infrastructure. Do you have a question?
Yes. Did you say that the public housing projects were intended to house middle class and working class in the community?
Yeah, I mean, we're not talking necessarily about the salaried middle class, although in the cities that were that had really suffered a major loss of housing stock, places like London and Plymouth and Coventry, it was possible to imagine public housing projects as being socially mixed in across quite a large range of social groups. It tended to be much more, in most areas, working class and lower middle class people. Any other questions? Yeah, Eric. Yeah. Yeah, so there was basically 3 types of, rather like the tripartite healthcare system before the war, there was a similar sort of tripartite educational system. You had elite private schools, you had these grammar schools that were fee-paying or had a charitable endowment that enabled some, that provided scholarships for some people, and then you had local school board schools that had been created in the 1870s. And so what they did was abolish the fee-paying grammar schools. Some of them decided that they didn't want to become part of the public system, so they went independent, but most of them became maintained by the public sector. Any other details? Yeah.